Good afternoon, and thank you for being in today's webinar entitled Impact of Social Determinants in Hispanic and Latin Population and its Relationship with Anxiety in Communities. Today's activity is in Spanish, and if you would like to hear the presentation in English, you can go to the tab for interpretation in the menu on the bottom and click English. You can also mute the original audio if you would like to do so. Now, before we begin, we will go through some housekeeping rules. Today's activity will be recorded and will be made public in our webpage. For this workshop, all the participants' microphones will be off. Make sure that the speakers of your computer are turned on and to a high volume so you can listen to today's presentation. If you have any technical problems, send a message to Hispanic Latino Behavioral Center in the chat. If you have any questions for our presenter, we are going to ask you to use the Q&A feature in the toolbar in the bottom. Write your question and hit send. The presenter will be available for questions at the Q&A session or at the end. We will be sharing a PDF presentation through the chat, and we will also give you a copy so that you can download it in our webpage. You will find it under today's title of the webinar. At the end of this workshop, we would like to ask you to please complete the evaluation, which will help us know a bit more about your opinion as to this webinar and what other topics and trainings you would like to receive. We will share a link to the evaluation in the chat, and you will be able to scan the QR code at the end of the presentation so that you can complete the evaluation. Our mission is to support behavioral health through promoting prevention, intervention, and multiple pathways to recovery and supports for recovery, which are strengthened by community, culturally rooted, and centered in the person for Hispanic and Latin communities, providing technical assistance and training and supporting the expansion of the workforce for behavioral health that serves Hispanic populations. Today we have with us Dr. Patricia Lander Santiago, who is a psychologist specialized in the clinical and school area. She's an associate professor of the school psychology program of the graduate school of the Catholic University in Puerto Rico. She also has a private practice in the city of Ponce. She has a PhD in clinical psychology from the Ponce Medical School, today known as the Ponce Health Sciences University. She has a master's degree in education with a major in school psychology from the Catholic University in Puerto Rico. She has a vast experience in the school area, having worked as a teacher for the Department of Education for 16 years. She was the president in 2023 of the Puerto Rico Psychology Association, and from 2018 to 2019, she was a president of the School Psychology Association in Puerto Rico, and she was also a secretary in that association. She was a representative for Puerto Rico for the National Association of School Psychologists, or NSAP, from 2022 to 2025. Dr. Lander Santiago has provided workshops, conferences, and training in various topics related to mental health, comprehensive well-being, and use of substances, both in Puerto Rico and in the U.S. She provides consultancy to both private and public schools and nonprofit organizations, and she has collaborated with IRESA, providing workshops about emotional well-being in children and adolescents during the pandemic, psychological first aid, emotional intelligence in the work area, substance use disorders, and crisis intervention. She's also a specialist resource in mental health in the country's media. So without further ado, I will now leave you with Dr. Patricia Lander so that the workshop can begin. Thank you, Paola. Hello, everyone. Thank you for connecting to this webinar today. So good morning for those of you who are in other time zones. And I'm looking at the chat and I can see that there are people from Puerto Rico and from all over the US. So I'm so happy to be here and spending some time with you. this afternoon, at least afternoon for me, our objectives is basically what we would like to achieve during this time. We would like to teach you a little bit about the social determinants to be able to identify them, identify those social determinants that are predominant in the Hispanic and Latin population. We would like to define what mental health is because it's always a good idea to review and go over it. And probably much of the information you already know, but this works as a review of all that knowledge that we already have. We're also going to be identify factors that affect mental health. We are going to learn a little bit about anxiety disorders and the prevalence of these disorders, specifically in Hispanic and Latin populations. And we will also be providing recommendations to work with Hispanic and Latin populations. So thank you so much for writing where you are in the chat. And just to give you my information, I'm in Ponce, Puerto Rico. So hello, everyone. And we will begin. First of all, so that we could place our conversation into context, we're going to talk a little bit about social determinants of health. When we talk about social determinants, it is basically the conditions in which we all are born, raised, where we live, or conditions in which we live, work, and grow old. So all these conditions are social determinants because they influence our well-being, both in physical, mental, and social terms. It is very important to know or review or emphasize that social determinants will be shaped or determined, even though we're repeating the word, obviously, according to how resources, money, and power are distributed both at a local, national, and international level as well. And social determinants are fundamental so that we can understand more thoroughly the person's needs in terms of health and in other aspects of a person's social development. What are the main social determinants? We're talking about conditions, money, power, etc. So one of those main social determinants are precisely the financial conditions or the level of income of a person, their work related conditions, also the access of these people to education and what surrounds them, their surroundings, social and environment, their family and community relationships. So when we talk about social determinants, these are the main ones, or the ones that we should place more attention to. We also need to take into account the access that people or each person has to basic services, meaning health care services, community services, etc. We also mentioned the cultural factor, which is very important, disparity, and public policies. So when we speak about social determinants, all these issues are also important. Now that we are going to look into some examples. For example, when we talk about the social determinant, about the financial conditions and income of a person, for example, a person who lives in poverty or under the poverty line would be a person who has a limited access to nutritional food, which affects their general health. And not too long ago, I was invited to a conference about comprehensive well-being, technology, in a symposium. And before I began my presentation, I was saying that when we talk about comprehensive well-being, we say, well, you have to eat healthy. And it's very easy to say, well, we have to eat very healthy. If it's easy, if we have the resources necessary to buy healthy food and to cook it in our home. Because if we notice, often the healthier foods are more costly. and at a higher cost, then we have to, let's start with the most basic thing, water. We are going to choose something to drink, and a bottle of water costs $2 or $3 when a can of soda costs $1. So if we are on a budget, oftentimes the budget will go above what might be more beneficial to us. So when we have that lack of access, that also affects our health. When there is no financial stability, then the levels of stress and anxiety will also increase. For example, in terms of education now, a child who goes to a lower quality school because they probably will not have the necessary resources to pay for, because that school doesn't have enough budget to pay for good teachers, to have the most modern in terms of technology, books, etc. Probably this will possibly affect and make this education not be the best one possible. And in the long term, that child might not be able to find a job that will be better compensated than others. In addition, adults with lower educational levels tend to have less knowledge about illness prevention. That is why we often talk about this, and I am a big supporter of repeating that education empowers people. Because when I know something, when I know about something, I learn something, I can then have the necessary information to assert my rights and to know what I have to do so I can live a better life. Another example, when we talk about employment and labor conditions, these workers who have low wages or whose labor conditions are not the best are usually going to be living with this financial lack of financial safety. When labor conditions are hazardous or they don't meet the regulations that a job should meet, the person could be at a risk of suffering injuries or other occupational illnesses because of those precarious conditions that they're working in. A worker, obviously, who gets sick, who gets injured, then needs to leave their job probably, and then their income disappear or go way down. In terms of housing and the physical environment, that's another issue, because oftentimes people who cannot pay for the maintenance of a home, then they resort to living in housing that is overpopulated. You have to live with more people, and the more people you live with, then the level of healthiness or cleanliness or lack of privacy, etc., the level of anxiety increases. And when we talk about the physical environment, when people are exposed to environmental pollution through the air or the water, then that can lead to chronic illnesses.
Provide example what are services to health care. For example, in communities that are rural, a lot of times they're farther away from clinics and other healthcare services that are offered. The limitation in transportation also contributes to them receiving less healthcare or having received that healthcare being more complicated. Another factor that we're seeing a lot of is the lack of a healthcare insurance or plan médico, as it's called in Puerto Rico. It's important that we're seeing other factors along with this, which is the number of healthcare professionals in mental health and regular healthcare that are not being providers of health plans at all anymore. And even professionals that have good employment and have access to a good healthcare plan, they cannot use it or they're not good enough because healthcare providers are not accepting them. So it's a double-edged thing. It's very important that social support networks are very important. People who lack these kind of support networks are more likely to suffer from depression. So sometimes when we see patients or people that are coming to receive healthcare services, always have a support network, because that support network, as if they're strong, they're more important. They have to be strong and determine how people receive, how quickly people receive, and how receive healthcare and how quickly they recover. So if they lack that support network, that recovery can be delayed or take longer than usual or be more difficult to receive. It's very important that when we talk about support networks, we're talking about people that are present in their lives, family, friends, co-workers, community members, community leaders. Sometimes there's a community that a neighborhood group is very strong. And if somebody gets sick, everybody pitches in with food, with help, with childcare, and so forth. So those support networks are really important. The ones that are here that are professionals in mental health have to explore that aspect of clients' lives. A lot of times, people that come from other countries or are moving from another state, they begin that process by being alone and not having that network. So we have to take that into consideration. When we talk about disparity or inequality, we see the difference in racial communities. A lot of times unemployment is higher in these kind of communities because prejudices are real and they have to face it, and we see it all the time. So also, as we're referring to Hispanic and Latino populations, they can live through this prejudice and discrimination, and it affects their access to healthcare. Also, culture and social norms. Why is this a determinant, a social determinant? Because in a lot of cultures, to seek psychological help, it might be stigmatized. So the ones that are looking for psychological help are either crazy, quote unquote, or they're not really strong enough to manage their health issues, or they're weak. We talk about a glass generation, that anything that affects them breaks them, and they complain. So all these stigmas and taboos can be can come into play in the cultural sphere, and they delay healthcare for these people because they are repressed, or they don't feel like looking for psychological help, fearing what other people might say. For example, in Puerto Rico, we talk a lot that people who are seeking this type of help are crazy. I have patients that tell me, "Doctor, I will pay for this visit or for this session cash, even though I accept their health plan, because they don't want any documentation of these help in the official record." We're at 2025 and we still have people, that is completely understandable, that it's not that they want to be judged or we don't want to judge, but we have to mention the reality that this taboo is real and it affects a lot of people. A lot of Aide, I don't know if that's how you mention it. You're correct. You're completely correct. As time goes by, we become more disconnected. And with the pandemic and the lockdown, that kept us away from building community. And culturally, that means that a lot of people may suffer more than others. There's some people that consider this very important. A lot of cultures are more dependent in the family and nuclear units, and to seek help, it's not easy, and it's hard. So this doesn't say that only it's not about pride. It's not just about pride. They're not going to seek help just because they don't want their pride to be harmed. There's also fear of rejection, and this is very true. I described this that we function as pitchers and catchers, to use a baseball metaphor. These two positions are very important. The pitcher throws the ball, pitches. The catcher catches it, right? So they have to navigate these two functions so that it seems like a strike when the batter is going to hit, and they got to trick the players, right? Or maybe they got to steal a base or something. Everybody has their function. A lot of times we see people that want to have more than or have both functions. They want to play as pitcher and catcher. As a pitcher, I want to request help. But as a catcher, you say, I'm not going to mention anything because she's already full of problems and she's going through a divorce or a separation. She works too much. And I'm not going to say anything because she most likely doesn't have any time to get help. So you got to pick one of the two functions. If you're going to seek help, you got to seek it. And you got to allow the catcher, whoever provides the health care, lets you know whether they can help or not. Or if you have the time to listen to them, or if you're asking for a particular specific help and the provider makes a counter offer, they cannot provide that help, but they can offer this other help. So a lot of times we're using and playing both positions. So the fear of being rejected is real, and the taboo, our problems with taboos are fixed at the home, right, Elizabeth? The dirty laundry, as we say in Puerto Rico, are washed at home. We also say that the interpreter is not being heard. Anybody can hear me? So gender norms also limits access to men seeking help from therapists. Of course, Rachel, because a lot of times the male role within a family in some cultures is a strong role. They are stoic, they can take it, they fight, they don't cry. So these cultural determinants are very important. A lot of times seeking mental health help, they say they don't respect their cultural heritage or the beliefs. So it's important to educate ourselves about trauma, about this. Juan Carlos says that the stigma is real. It might be contagious. It's passed down through the generation. So yeah, I think Ilona, I don't know if I'm pronouncing it right. Cultural competition is something that we must recognize and acknowledge as professionals. Also, gender violence or domestic violence. To be aware of these things, to talk about these things, about mental health, has kind of improved, but there's some way to go. We still need to do a lot more. So let's continue. Thank you for your comments, because it keeps it more dynamic. It helps with the dynamics and it brings different onto the table. So thank you very much. We got to talk about food security. Families that live in so-called food deserts that don't have access to supermarkets or fresh and perishables, we see that a lot of physical conditions like obesity and diabetes are more prevalent. We must be able to control how much salt we use, if we use deep fryers or air fryers, or if we use any other seasons and other ways of cooking. We have to depend on buying processed food somewhere, frozen food. Also, access to transportation can be limited, and this prevents people from going to medical appointments or follow-ups. So prevention requires that we must be able to move before something gets worse. So if transportation is not available, our priorities, well, if transportation is limited, we're going to prioritize, when it's absolutely needed, and to take into account or in consideration families and social support for those who have mental health issues, those who are intervened psychiatrically or that have psychosis, were said not to be able to be dealt with within families. Thank you for sharing that. An aspect that is sometimes controversial is public policy. Because a lot of times they're misinterpreted as partisan policies against a certain candidate or a certain person, but public policies promote income equality so that poverty gaps are breached and mitigated. Also, public policy helps us implement social programs, housing subsidies, housing conditions, programs that provide access to vulnerable communities and so forth. So public policies go beyond that. Yes, a veces, of course, because then we say, eat healthy, right? But we still make the same amount of money. We still have the same budget. So we end up eating at McDonald's, and McDonald's is not as cheap as it used to be, like $3 or $3.99 or $4.99. Now to go to a fast food is not that cheap. It's actually expensive, and it requires time to go to different stores without transportation or a car, without any income stability. So that's where you see inequality that we're talking about. And just as there's a lot of fear, that people have a lot of fear when they seek for this kind of help. I'm losing the audio, is getting interrupted. Okay. So
I'm back. Can anybody please confirm that you can hear me? I think, okay, yes, I'm gonna share my screen. So can somebody tell me if they can, this is the presenter is asking if somebody can tell her if they can hear her. Okay, people are confirming in the chat. Oh, I'm so sorry about that. So as I was saying, what is the impact of these social determinants on health, and why is it so important to talk about them and learn about them? Is because depending on all these determinants will be the impact they will have, for example, in health. If a person does not have access, does not have the money, does not have health insurance, does not have a legal status, does not have transportation, etc., they will obviously be exposed to severe or chronic conditions. Why? Because there can be no prevention in those cases. As I had said before, prevention is almost a luxury, because instead of going to one appointment per month, then you can go just to four. You need to go to four appointments, and I can't do that for different reasons. In terms of education, the impact will be in the opportunities that person will have. If we are in areas where there are no financial resources or not enough financial resources for a good quality education, best jobs will not go to these people, or these people will not have access to them. And that will lead to financial instability, because everybody expects that the better the education, the better the opportunities that we would have. And then access to better paid jobs will lead to financial stability. Social determinants also have an impact on general well-being, because these have to do with housing, with safety and security, and with your community environment, what's, our surroundings. And as we mentioned before, that community support is truly important. It's very important, and it helps or improves a person's well-being as human beings, as people in our community. So why is it important to talk about this topic of social determinants? I'm going to look at the chat to see if anybody can answer this question. Why is it important to talk or address the topic? What we're doing today? What is it important to address the topic of social determinants like we're doing here today? Yes, Javier, the barrier of language is very important. Lily, yes. Thank you, Joshua. So why do you think this is important? Because many people don't know what this means or how it affects them. We understand, the origin of anxiety, to know the risks of suffering anxiety because the impact they have in individuals and family. Yes, exactly. They impact our patients directly, as well as interventions that we can use with our patients to increase awareness so we can increase support. That's the first step. To solve a problem is to identify it and know the roots of that problem. That's very important. We need to know the factors, how to help our people, how to make people better, access to medical and mental health. If you don't know what your client is struggling with, you cannot be fully effective in helping them. Kimberly, yes, exactly. I agree. Yes, to deal with stigma and ask for assistance. Thank you so much for your answers, all of you who helped out in the chat. Thank you so much. So the importance of addressing this topic of social determinants, first of all, it helps us to understand inequalities. It helps us understand that two people might come from the same backgrounds, but they will not have similar conditions. The reality of each person's lives, of those people that we know, that we live with, that we serve and treat, is completely different. It also helps us create solutions that promote health sustainability. It helps us to create and support effective public policies. And I had mentioned before, public policies are anything that help us create programs that help us provide access to health services, to housing services, transportation, etc. And it also helps us in community efforts that can help improve conditions and therefore opportunities in a person's life. So, to give you an example, a person who lives in a neighborhood with a high level of poverty low quality schools, and a lack of access to health care. We have that on one side versus another person who lives in a neighborhood with high levels of poverty, low quality schools, and access to health services is more likely to experience health problems, educational difficulties, and financial limitations as compared to another person who lives in an environment with better resources. It is very important to recognize that this is not a given because there are people who, even though they might live in neighborhoods with a high level of poverty, in one way or another, they fight for their rights and they, solve their problems and in one way or another are able to gain access to these things. It doesn't mean that just because you live there, it will be for certain, but it is a factor that can lead to these conditions. They could experience health problems, educational problems, financial limitations, etc. So that's important to keep in mind. Yes, Javier, we also have exposure to addictions or problematic use of substances because oftentimes it is in these communities or in these types of housing situations where we see substance use, even though it's not limited to that, that have to emphasize that it's not just limited to only these areas or these places, of course. When we talk about the Hispanic and Latin population, why is it important? It's because it allows for improving and promoting the integral development. And we talk about comprehensive or integral development, we're talking about everything: mental health, physical health, housing, education, living in peace and harmony, being in a safe environment, clean air, etc. All those things. So it's very important that we recognize these challenges because there are structural factors. And when we say structural, we mean the system in which we live, the system, the way it's governed, the government system. Also, in terms of the cultural factors, and many of you have mentioned them, cultural factors that affect, that taboo, limiting people's opportunities to seek for those mental health services, and also the economic factor, of course, that has an impact, a negative impact in quality of life, because it's not the same thing to have a budget for, like family, um, fun, etc., versus not being able to have some money to do that, to have those family activities, etc. So your quality of life is affected when we don't have that space, that ability to have that to enrich in a cultural way, to have family time, etc., because that would help us reduce inequalities, improve our quality of life, and so it becomes like a domino effect. So, which do you think is the social determinant that has the biggest impact on mental health, including substance use in your community? So, which do you think is a social determinant that affects mental health the most in your community? And that includes substance use. So, I'm going to give you a couple of minutes to look at your answers in the chat. Which social determinant do you think has the biggest impact on mental health in your community, including substance use? Let's see. Trauma, financial factors, emotional support, stigma, poverty, financial. Lily says all of them. Lack of information and taboo, economic factors, stigma, harmony in the family unit, lack of resources. Yes, needy, exactly. It's like a domino effect. Stress, environment, economic factors, all of them, racism, yourself. Um, Blanca says that they're all connected, economic disparities, that limits access to services. I love this group. Let's see. Substance use disorder, that the mother of the family is respected, lack of resources, making time to access the resources, housing, etc. Thank you so much. Thank you all for participating. You're very active. And I really like that in this group. Thanks. So let's now look at the relationship between social determinants and mental health. For example, when we talk about social determinants and their relationship to mental health, financial conditions that we see here as a first aspect represent a constant pressure. And you all mentioned that the economic factor is very important. And that constant pressure can lead the person to develop anxiety, depression, or other mental health diagnosis. Mainly anxiety, because the main characteristic of an anxiety diagnosis is a constant concern, a constant worrying. It's a person who's constantly nervous, constantly worried, anticipating events, etc. And depression, because of course, a person who financially cannot meet the responsibilities of their household, cannot offer their children or their relatives a good quality of life, will be a person whose mood can change and can be affected by these conditions. Access to education is another factor, because the less access that you have to education, then our self-esteem is affected, our general well-being is accepted, what we said before. The less education, access to better paying jobs will be more limited or more difficult. Yes, Faustina, exactly. It's too much responsibility in work and in the home. We have been seeing that, and that increased quite a lot during the COVID-19 pandemic, because we went home to work. Those of us who was able to do that, to work from home, and then you were just available 24/7. Yes, Jessian, the emotional load because of different world events that can also affect us, of course. So, the third factor, when we talk about social and community relationships, that factor is very important, because lack of support in a social sense or in the community leads us to isolation and loneliness. Ide is saying here, oh yes, working from home was nice, but created burnout. Exactly. For some of us, the first few days, we're like, oh, this is great. I'm at my house, I'm working in my PJs in the computer. But at some point, we were too exposed and too available and accessible. Everything was new for all of us. So at least for a large number of us, we didn't really know how to handle this. And we were answering emails all the time, calls, we were accessible for meetings all the time. And it was very difficult for us to meet with our work schedule.
Oh, okay. Yes. Yes. If you can listen to the interpreter, please say so that we can continue on. Okay, we can hear you now. Perfect, perfect. Okay, it's back. Thank you. Thank you for letting us know. When there's no support, we become isolated. And a lot of times when somebody becomes isolated and they're alone or lonely, they see loneliness or solitude as something negative. And of course, they're going to feel that they're alone, that they can't talk to anybody, that nobody's supporting them. That's a complicated feeling. It's a hard feeling. So, what are the risk factors when we're talking about social determinants and mental health? There are certain risk factors. Why is it important to know these risk factors? Because I'm having signal issues again. I'm sorry. I can't. We have to be aware. A risk factor to the developing to the develop. I can't. I'm sorry. Can somebody tell them that her signal is yes, and their job is secure. Yes. Right. I indeed. All right. All right. We'll go on. And I'm sorry. I apologies. And thank you for letting me know that you can hear me. Thank you to everybody. So then we were talking that a person that does not know for certain where there's a notification here about speaking language, so I'm gonna change it to Spanish. So where is your next check gonna come from? Where is that person's family has the liquidity to cost for healthcare? We're talking about people that have limited access to funds and to money, or who are poor, or toe the poverty line. The conditions that we're living in today, we must remember that there are cuts, that there's problems with payroll, with providers, and so forth. So when a person doesn't know how they're gonna pay for their mortgage, how they're gonna pay for their groceries, that financial insecurity can be a risk factor. And also the lack of access to services. It's important for us to recognize and acknowledge where do we need to have these services accessible to the community. We talked about rural areas. We talked about probably those places that are remotely located in remote areas, that those access to services must be established. Now, remotely, we have been able to reach other populations. Sure. However, not everybody has access to a computer or to the internet. Like me today. I thought I had a good internet connection, but today it's not being very good. So the patients that I saw remotely in the morning, we've had issues from both ways, on their side and my side, because the weather is rough. So we can't just take it for granted that the virtual environment, being remote, facilitates and makes things easier. We don't have to move or displace ourselves far to receive services, because we can receive it remotely and have the correct tools and the correct technology these people must have to be able to have access to healthcare, and also inequalities. When we're living constantly with unequal treatment, from payroll to the jobs we have access to, the jobs that we're considered for, there's people that even with jobs don't have the income necessary to cost healthcare, and they don't qualify for some services. Yes, Alexandra talks about privilege and oppression. These are factors that we have to make sure that they're important. We know they're important factors. In that sense, we have to take into account the inequalities inherent in this. We can continue, Paola. Can I pass the slides, or do you have to do it? I think I have to do it. Just let me know when you want me to do it. Okay, perfect. Other determinants, social determinants, as we're looking at risk factors, they're the ones that can provoke or exacerbate healthcare, mental health conditions. And those are risk factors, but other factors that we call the protective factors are those that help us to take care of ourselves, that provide us with tools so that we can maintain a certain level of mental health, stable mental health. For example, support networks, families, family units. Support networks can come from our families, can come from our friends, they can also come from our community. We've talked about this. People have talked about this in the chat. How we see the community support, which can be more reserved or sometimes more distant. They also mention, and you have been mentioning in the chat, cultural competency. Those services that are culturally sensitive become protective factors, because those people that feel that they're getting the services, the healthcare services that are respecting their cultural nature, that understands their traditions, their language, all these things will make them feel comfortable with the healthcare provider. And that will help for them, for them to seek that help and come back over and over to receive that help. As well, the public policy, we can develop public policies that create better access, better conditions, better programs that help us with childcare, with taking parenting, with studying, and so forth. Those things are very important. Amanda, the recording will be available afterwards. After the presentation, you will have access to the recording. We can go on to the next slide. So now we're going to talk about substances and mental health. And I'm also having signal issues as well. A complete physical a complete well-being state of physical, mental, and social well-being is not only the absence of affections or sickness or issues and sickness. Not really. Okay, so then, if we follow the comment made by, and I lost the audio again, and I believe the professor was disconnected. Apologies. I know this has been a little bit testing our patience, but we're going to continue and try to make the best of it. Let me know if you can hear me. Apologies again. As soon as I see the presentation, we were talking about language and how in Puerto Rico, Spanish is not the same as Mexican Spanish or Venezuelan Spanish. So that creates some difficulties. I was traveling recently to a convention, and somebody in the elevator asked me if I was from Puerto Rico. And I know, Ricardo, the rain is affecting the connection. We must be resilient and stay the course, fight the good battle. Yes, Can you tell that I'm Puerto Rican? Yes, because you speak such a peculiar way. So we see that in psychological testing when we evaluate or assess students and clients. A lot of the norms come in Spanish from Spain or Venezuela. And yes, Andrew says that he's Argentinian and he had to learn Spanish all over again. And I believe Alexandra said that she would use it in her own favor. And that's great because we use it a lot. I do that a lot with adolescents and teenagers because even if they're Puerto Rican like me, they have a different slang. And I asked them, what does that mean? What's a crush? Because in my time, crushes were the artists that we put posters up on the walls of our rooms. No, we now use it as that's the girl or boy that I like nowadays. So language, it does not, you know, when you're going from Spanish to Spanish or generation to generation, the language changes. Probably my Spanish or my language is different from my teenage patient's language. So, like Alexandra says, we must use those differences to our favor. That's a great strategy. That's a wonderful strategy. So, when we talk about mental health, yes, Puerto Ricans, we know each other anywhere, of course. And common phrases as well, as Alexandra says. I used to have a Colombian patient, and they would say, "This was like that." And I said, and I would laugh and say, "What does that mean?" And they would tell me, "You say like this," and I would identify the same thing in Puerto Rican Spanish. So differences can make us join, bond more with our patient. So we must decide how open we are with these people that come to us that are different from us. So being open and being flexible is very important beyond just our roles as healthcare, mental health care professionals. So the World Health Organization defines a full physical, mental, and social well-being, not only the absence of issues or sickness. So having well-being does not mean having a lack of sickness or issues just because we don't visit doctors or psychiatrists or psychologists. So it doesn't necessarily mean that if you visit a psychologist, you're going to get diagnosed with something. It's having that well-being in the physical, mental, and social context. So let's go on to the next slide. When we talk about this full well-being, we go from the emotional to the spiritual, and the spiritual component is very important as a cultural factor. There are a lot of cultures in which the spiritual is very important. There's also the intellectual well-being. For you to connect here and participate in this webinar is part of your intellectual well-being because it promotes your knowledge, your learning, help that you can provide in your professional environment. So there are different types of well-being, and we can go on to the next slide. In each people. So when we talk about mental health, we're talking about this kind of well-being. But it also has to do when we say we have mental well-being, we're talking about how we manage stress, how we decide things, our decision-making process, how we deal with trauma and so forth. In the United States, mental health problems alter the way a person behaves and their feeling. So mental health issues like schizophrenia, depression, and bipolar issues are some of the ones that are most diagnosed in the United States.
Something that is very important is that we need to determine what mental health is in opposition to mental illness, because there are certain conditions that are temporary. For example, if you lose your job, very likely your mood will change. You will have anxiety symptoms. It might be difficult for you to function on a daily basis. But once you find a new job and start working again, then you will become functional again. So when we talk about a mental health disorder, it is something permanent and that accepts a person's ability to function. So their mental health might be affected or impacted today because they got bad news, they lost a loved one, they lost their job, their girlfriend or boyfriend broke up with them, or you left your girlfriend or boyfriend. But those are transitory, temporary conditions that might alter my mental health, but will not necessarily become a disorder. So that's a very important factor. And we need to educate people a lot from when they're little that just because you're sad doesn't mean that you are depressed. Sadness is a feeling. You feel sad today. I could be sad today and be offering this webinar here because it's something that's inside you. It's just a feeling. But that me being sad does not necessarily imply that I might develop depression because I might just deal with it. I have support, etc. And a few days later, I'm stable. So that's important. Mental illness or disorders are more permanent and directly affect how people think, how people act, etc., and the decisions that they take as well. Some indications of alert or red flags that we can see in people. They stop enjoying things that they used to do. There might be sleep disorders, and sleep and diet can be affected. They might increase or decrease. They might stop eating or eat less, or they might start eating more. The same thing with sleep. Using drugs or alcohol in excess, having sudden mood changes, the levels of energy, low energy levels might be an indication. The book or the guide that we use to diagnose these disorders is the DSM. And we have now the fifth edition, DSM-5 TR, like revised, the revised text. This is the most recent edition, and that's where we find all the signs and symptoms in order to make a diagnosis as such. So that's very important that we all are aware of this, and mental health professionals are the ones who use the DSM, and that's the guide that we have in terms of signs and symptoms so that we can make a determination as to a person's diagnosis. Yes, Laura, DSM-5 TR, exactly. So it's very important that these mental disorders, as I said, represents a clinically significant disorder in the cognitive state, which is what we think, decisions we make, emotional regulation, or the psychological and biological processes of a person's development that underlie the mental state. So these are usually associated with significant stress or a disability in various aspects of a person. And of course, humor and the sense of humor is very important. I don't know why we're losing it. I don't. So why what we do to diagnose a mental health disorder? Not just look at the person, we need to see the history, we can do a physical examination because there's certain physical conditions that could be associated to a change in mood. For example, thyroid changes, diabetes, for example. If our glucose levels are altered, that could cause sadness, tiredness, and we might think it's a mental health disorder when it is actually not. So, one of the things that we need to do as professionals is to discard any physical issues first. Also, we need to explore events, issues, things that we have happened in the past. How have we managed them? What impact have they had? And that way we can see how the person behaves usually. Something that's also important, if we see people who on their the effects of substances behave in a certain way, it's important to evaluate that. But we also need to see these people in their natural state so that then we can see those differences and see whether those are effects of just the substance use or if there might be characteristics or or things that are particular to this person in particular, or if it's just the substance. So to do that, how do we evaluate? We use questionnaires, we do interviews. If they are children, then we have to interview the parents, but also we can do different interviews with them, for example, their caretakers, etc. When do we know that treatment is necessary? When we see changes in diet, in sleep hours, if they have difficulty facing problems, if they feel disconnected or they isolate themselves, if they have unusual or quote unquote magical thoughts, excessive anxiety or worry, sadness, when they say that they have a thought or an attempt or they have had an attempt to against their lives or suicides. And in Puerto Rico, talking about, common phrases, we say if you're in doubt, then take care of it, so to speak. So if we see anything that's strange to us or seems weird, we should check that out. We should revise it and review it. Sudden changes in mood, excessive anger, violent behaviors, things like that. So the Substance Abuse and Mental Health Services Administration, or SAMHSA, has stated that these mental disorders could significantly affect general health, and this has a big influence, specifically in teenagers and adolescents. We can see difficulties in their academic performance, behavior problems, students who are usually behave very well and suddenly they don't want to study, they challenge the authority. A behavior problem in a child, in an underage child, also is always a symptom of something. It can be an emotional situation, some learning problem, a reflection of some trauma, a situation that's happening at home. It does not necessarily mean it's something tragic, but a change in behavior is a symptom or a sign that something is happening there. Keeping, like a regular schedule. Parents tell me, like, doctor, for a week, they've been sleeping like 12 hours a day. So that's a sign that something is happening. The difficulty lies in identifying what is happening. Also when they have difficulties having healthy relationships or maintaining adequate hygiene, when sometimes they don't take a bath, they don't shower, they use the same clothes for 2 or 3 days in a row, although that also can be a normal thing in adolescents. They sometimes do that as well. So a question I get asked is, how do we know if it's a regular characteristic of the teenage years, or if it's something else? Sometimes it's the intensity. If it's very intense, maybe it's more than a normal characteristic, the duration as well, or if several signs show up together. And sometimes that we speak about culturally, the fact that you have mental health problems does not mean that we're weak, that we have a character flaws or things like that. So yes, Andrew, you are right. Those magical beliefs could have a cultural root. Of course, we need to explore that. Obviously, if they say, "Oh, I see the Virgin Mary, the Virgin of Guadalupe, for example, I see her in the mornings, for example." Okay, so what does this mean for you? Well, this is normal because we believe so fervently in the Virgin. When we see her, then that means that she's with us. Just to give you an example, right? Of course, we need to explore that because it might be cultural beliefs. But something that's important is we also need to know that oftentimes mental health problems have their roots in biological factors. For example, our genes, physical illnesses, health conditions that directly affect our moods. And that's different from saying, I was diagnosed with such a condition, and that caused me a depression. That news, then that's a separate thing, of course. Another thing is when a physical condition directly affects or has a direct impact on our mood. I mentioned diabetes, I mentioned thyroid problems, etc. Trauma or a history of abuse is another thing. A person who has experienced trauma is not in the same situation of another person who has not had any trauma or a history of abuse, family histories. If there is a family history of mental health problems, people could inherit those or they are maybe predisposed to them. So doing a psychosocial history is very important. And through those interviews, we can learn about possibilities. So now, most common mental disorders, we have anxiety disorders, we have mood disorders, and we have schizophrenia disorders. And we are going to talk about the main characteristics of each of them at this time. Anxiety disorders, DSM-5 describe them as conditions that are characterized by excessive worry, intense fear, and persistent fear, or a disproportionate response to the situations that are perceived as dangerous. For example, a person like a friend of mine, she is deathly scared of lizards. And in the apartment that she bought on a first floor, a garden level, she finds these lizards all over the place. And a few days ago, she told me, I'm selling that apartment. I don't go into my house until somebody goes in first and takes care of the lizards and gets them out. So that might seem disproportionate. It's not that we don't understand her or validate, but we have to measure, or lizard versus us, which is a big human being who measures 5 or 6 feet tall. So these types of responses in anxiety disorders interfere in the individual's daily life and their functionality and their anxiety. So when something
When something
interferes with our
interferes,
functioning, that is when we know that it is not something that is normal, but that might be affecting our stability. The anxiety disorders are the most common types of disorders. They are scared of situations, of different maybe objects, animals, etc. So these people try to avoid the thing that triggers their anxiety. I don't go out into the countryside because I'm terrified of snakes, for example, or I don't never go to activities where there's lots of people because I feel like I might die. I'm not being able to escape from that situation if it's too crowded. So they start going into behaviors where they avoid these things. So a person with generalized anxiety disorder, this is a concern in different areas of their life, family, work, or health for at least 6 months. Symptoms: muscle tension, fatigue, irritability, difficulties concentrating, sleeping problems, on disproportionate concern or worry that interrupts your daily life. And they could also experience other symptoms such as lack of calmness, fatigue, tense muscles, sleep interruptions. We have seen those things.
anxiety, panic attacks, where people feel that they're going through a heart attack and they could die. The important thing is that if somebody has an anxiety disorder, you can say, they can tell you they're anxious and you ask why and they say they don't know. So a lot of times there's no explanation for what they're feeling. So at the same time, they could be in a daily situation that is not really dangerous or that they feel danger. They don't feel danger, but they do feel those symptoms. So they can be triggers. So we got to take this into account because it's frustrating about people who live with anxiety. Because a lot of times the people that surround them, around them, want a reason, but they can't provide one. Following. panic attacks or panic disorders, tachycardia, they feel like they can't breathe, hands hurt, migraines or headaches, all that feels like a heart attack, but really it's not. It's one of the reasons why people go to emergency rooms. And when they get tested, when they have their heart tested, everything is fine. And then they are referred to psychologists, psychiatrists to do follow up. We also have phobias, these simple social and social phobias are people that are afraid of other people's judgment. So there's the people that don't want to speak in public. They don't go outside, and so forth. It's very important that we can see, all right, that these anxiety disorders, and you can follow the next slide, agoraphobia, in which people cannot go outside and they feel like they're helpless in a social context. The separation anxiety, kids suffer a lot. Being silent and muted, a lot of kids are quiet at home and in the school. So this can be due to trauma or something like that. Following slide. Also, we see the prevalence in anxiety disorders. You can have this in the recorded presentation and the PDF. Let's see if we can go on to the next slide so we can cover all the material. And you will have it as a reference. We can go on to the next slide. Okay. What is the effect or impact of anxiety disorder? Well, there's physical and mental health. There's symptoms that they are felt by the client, to be redundant, that we live physically and mentally. Also, laboral functions, because we cannot get up early or we're worried at work. And if we're worried, we cannot do our jobs right, or we can take care of other things, as well as our family relationships. We can go on to the next slide. A lot of times it's hard to understand why people are anxious or worried because there's no seeming reason for it. So it's not everything is negative if we have a support network. Cultural factors like mutual help and collaboration and the capacity or ability to adapt to adverse environments can help us face this diagnosis and others. Next slide. So that we talked a lot about resiliency. And a lot of people, instead of resiliency, they use resistance, because resilience is our ability to overcome certain situations that happen to us. But resiliency is not that we're going to accept everything as is and that we're going to face everything always. Everything that's thrown our way, we're going to face, because that's not the right term. The right term is that we can face these things. And what helps us to do this? Next slide. Uh-oh, I'm having audio issues as well. There are certain cultural things that help us and cultural factors. The community is very important. Our relationship to happiness. So we use community help. It helps on our well-being. And at a community level, everything that helps us, as well as community leaders, can help us to move forward. The importance of the family is very important to a lot of Hispanic and Latin communities and cultures. Family is very important for a lot of Latin communities and cultures. This is a factor that helps us, as well as religion and spirituality. A lot of cultures hold religion, and some studies have found that to go to religious services and to have a certain religious beliefs, it's a very important factor to bring us strength and resiliency during hard times. Next slide. Another factor that contribute to our resiliency, and we can go on to the next slide because we already talked about this. The CDC says that Latin people have the lowest suicide rates compared to other populations. And this is a lot of times attributed to cultural values and their religion and support networks like family and community. So it is very important to register. A lot of more Latins were register in the United States who are getting more education and better living conditions. And also in the Hispanic and Latino communities in the US, families, spiritualism, and religious beliefs contribute a lot to resiliency in these communities. Intervention and strategies and resources. What do we have? Let's gloss over this quickly. It's very important to have culturally sensible interventions, which you mentioned. So we have to take this into consideration and we have to train for this. And we can take webinars, we can ask people about their cultures. We must be open. Being open and flexibility is very important. Our sessions and our interventions must be adapted to the needs of the person. I cannot talk about well-being and going to the gym and eating healthy and to come to sessions once a week or to go to group sessions to somebody who doesn't have transportation or don't have enough income to pay for transportation and all these things. So we have to adapt our help to all the social determinants that we have talked about today. Following slide. And that will help us fulfill that or achieve that our interventions. And I lost the audio. I'm sorry. Did anybody lose the audio? I can't see anybody's chat as well. Hello? For example, APA guides, the American Psychology Association, about spirituality and how you work with it during therapy. And the community participation is very important. We can go on to the next slide. Yes, seminars and training. Elizabeth, I agree with you. For example, cognitive behavioral therapy is one of the models that is most evidence-based models that is used. So we can adapt it to include cultural factors like values, materials that are culturally appropriate, and accessible language. For example, exploring how cultural beliefs related to anxiety have an impact on the patient's perception of their symptoms. So the more we know, the more we can adapt our models that are evidence-based and empirically validated. Following slide, reduction of language and cultural barriers. Offer the services in the person's language. If it's in Spanish, do it in Spanish. There are interpreters and translators that you have access to, like we have today, that will guarantee that they understand the services that you're providing. Let's go on to the next slide. If we're trying to intervene, have an intervention, and we do it in English, and that's not their language, that's not their vernacular, then it's not going to have the same effect. So in the schools, we must create programs that take into account the social determinants that have an effect into our schools, communities. If we're inside these schools, we can create certain programs that take into account the social determinants of this specific scholarly community. Maybe it doesn't work in my community like that, but it does in there. So we have to provide access to the school's community to these kind of services that we can address. Let's go on to the next slide. You think that family systems work better than cognitive behavior that are too tailored to individualism? I think it depends on the reality of the patient. There are families that, even though they're culturally dependent on the unit, there's some people within those units that consider the family is not that important and are not affected directly by it. So the family system is going to depend to the role the family has in that client's life. So that cognitive behavior therapy we can use within the family system. Following slide. It's going to depend a lot on their context and their background. We saw this in the following slide. Sorry, Paula, I didn't realize you had gone on to the next slide. We know the systemic, like the challenges or the defiance may have roots in the family, so we have to address it collectively. It's not the same thing to address a patient that says, my father and my mother does that thing and my brother does this thing. Well, let's bring him in to the therapy and let's all talk about it. Because that's a systemic family intervention is more appropriate in this kind of context and for mutual support and to have an open communication. Following slide now. Yes, there's a lot of people that are excusing themselves. I understand that we have been delayed by the signal problems that I've had. So I understand that you're excusing yourself. Let's try to finish quickly. Let's go on, Paola. When we talk about social determinants and we address them, we got to know our populations that we are providing services to, where they have access to housing, to jobs. It's very hard to ask someone to come to therapy and teach them how to manage their emotions when they haven't had any food in all day, or when the client doesn't know if they're going to have power at home when they get home, or they're going to get kicked out of their house because they haven't been able to pay the rent. And the responsibility falls on ourselves. The responsibility does not fall on ourselves to provide the funds to pay for rent or power, but we can help them seek the support from the government agencies that are relevant to this, like the Department of Labor, Housing Department, and have these resources available according to the areas and the communities they live in. Sometimes we can tell them, hey, there's a program that provides lunches for people that don't have jobs. And we have to let them know about this because maybe they don't know about it. It's very important for us to be able to be aware what's accessible to them so that we can communicate it to them. Following slide. So what available resources are there? Let's go on. Online, we have the National Alliance on Mental Illness. We can find resources there in Mental Health America. They have online evaluations and cultural guides that are very important about what we must know about our clients. Some of these sites have information in Spanish. Elizabeth, what you're talking about is very important. An evaluation of the basic necessities is key. It's very helpful. And the access to bilingual services in mental health is very helpful as well. You're right. We can go to the next slide. Community centers. There's the Hispanic Leadership National Alliance, National Hispanic Leadership Alliance. They can contribute to specific cases. The Latino Community Foundation is another resource. These are all meant for Hispanics and Latinos. So there are online sites that you can access, and we can go on to the next slide, and you may be able to find resources for the populations that you are addressing directly. Next slide. Helplines for mental health crisis. From SAMHSA, there's a 24-hour crisis helpline. We also have the suicide and crisis prevention hotline. This is very important that people are aware and that they know that this is accessible. We can have signs and posters and ads in our offices, even though they're in English. But these are also available in Spanish, for example. The other day, I went to give a training with teenagers, and I talked about this hotline, and they were writing it on their hands with pen. Even when I told them you could text to this hotline. So this is very important that we must provide these tools to the clients so that they can have access to this type of resources. Next slide. No te preocupes. And it's very important that we must let them know that these resources are confidential. These hotlines are confidential. They don't have to identify themselves. They're not going to ask for their immigration status. They're not going to ask for additional information. So they must feel free that they can call and talk to someone. Next slide. So this is where our presentation comes. Sorry about the extra 5 seconds that I took up, that I used up. And thank you for being patient with my signal problems and technology and technical issues. I have been talking about, and I love this group because they have been so interactive. So if you have any doubts or questions and you want to place it on the chat, please, and we can talk about this. You will be sent the link to the evaluation so you can fill it out, and that will help us a lot to know what other topics you want to discuss. Thank you for your messages. Thank you for your support. And thank you to everybody for participating, for commenting, for everything. Thank you. Thank you. Sari, yes, the presentation is going to be shared. It's going to be sent to you, and the recording will be available. Paola might give you some information about this, and the presentation will be sent. The recording will be uploaded to our webpage, and I will share with you right now with the presentations that you can have it. We will also upload it to our webpage under the name of the webinar. Under the webinar's title, you will be able to find this presentation and the PDF. We're giving you examples of what we talked about here, that mental health disorder, if there are problems with the mental health, anybody can go through them. It's not a death sentence. Probably if you look for help, it will help you recognize that you're going through hard times. It's not necessarily a disorder per se. You know, it doesn't have to be related to weakness or being cowardly, or it's just, that's life. Everybody can face hardships in life. Nobody has it easy all the time. So we can talk about this. That's how we can see this. And we must look for evidence. Looking for evidence and facts. We address that by showing facts, and we can teach them what mental health specialists are, and they can talk about anything they want freely without any judgment. All those things are important. You get to educate people with information. Information empowers people, and that's important to take into account. Thank you, Claudia. I appreciate that. Thank you, doctor. At the time, we don't have any more questions. So you will receive a participation certificate along with the link to our evaluation. Please fill out the evaluation. And you can reply to the email in case that you have more questions, or if you want to suggest some of the topics that we should cover, let us know. Please, thank you for joining the webinar today, and have a good afternoon. And thank you, doctor, again. Thank you to you. Always a pleasure.